Hello and welcome back to Akademixx Global, your hub for innovative medical education. Today I will give you a complete practical tutorial on eAnatomy database by IMAIOS. eAnatomy is an interactive radiology and anatomy learning platform. It includes 10,000 plus annotated images which include CT, MRI, X-ray, angiography and diagrams. It is used for exams, clinical practice and teaching. Let's explore eAnatomy. Now I am signed into eAnatomy. eAnatomy interface is very simple. It includes anatomical and radiology atlas of different regions based on anatomical diagrams, CT and MRI, medical imaging exams. Region includes brain, head and neck, spine, whole body, thorax, abdomen and pelvis, upper limb and finally lower limb. Region selection filters all datasets, so always select region first to avoid confusion. Next is modality. Each imaging modality is best for visualizing different types of anatomy, like MRI is for soft tissues and neuroanatomy, CT is for bones and trauma, and X-ray is for basic anatomy, angiography is for vessels, and ultrasound is for real-time anatomy. First, I will select region. I will select brain. Then I will select MRI as imaging modality. Here it shows the result, and from these results of MRI, I will select the MRI axial brain. On left side, it shows dimensions. Anatomy must be understood in dimensions like axial, sagittal, coronal and 3D. The next option is search. Search allows instant localization. Let's search internal capsule. Search saves time during revision for your examinations. The next option is scroll. Scroll slice by slice to understand cross-sectional anatomy. You can use your mouse scroll button or your left button of mouse to scroll among images. It goes inferior to superior, and by each level anatomy changes, as you can see in this here in this picture. The next option is pan. Pan helps reposition the image. In case the next option is zoom. Pan helps reposition the image. In case when zoomed in, it helps to focus on region of interest. Zoom reveals fine anatomical details. The next option is menu. Menu gives access to advanced customization. It includes settings, display, language, and help. Bookmarks is important for quick access. Now we will start from the weightings. MRI weightings are different image settings that make different tissues appear bright or dark, helping us identify disease. Like T1 weighted MRI is best for anatomical details and baseline scan before contrast. We can say that T1 is for structure and anatomy, and the T1 GADU, which is T1 plus gadolinium contrast MRI, is used for detecting brain tumors and identifying active lesions. T2 weighted MRI is best for seeing abnormal fluid edema, and T2 star is to detect trauma, old hemorrhage, cerebral microbleeds. FLAIR is fluid attenuated inversion recovery. It shows best white matter lesions, multiple sclerosis, small infarcts, and it is most tested sequence in exams. And finally is the ADC, apparent diffusion coefficient. Its clinical uses are acute ischemic stroke, abscess versus tumor differentiation, and the next one is anatomical parts. It explains bones, muscles, vessels, nerves, and organs. Here you can see the anatomical parts, regions, sulci, Garvey, limbic system, white matter, and optic tract, cerebrum, brainstem, arteries, venous sinuses, and glands. Transformations adjust image orientation. It includes flip and and rotate. The next feature is labeling. Labelings are best for preparing for exams. For like, if you want to prepare for exams, like for quiz, you can off the labels. Like I just selected this option, practice. Now here you can prepare for exams. Like I'm selecting this tool, which is pericentral gyrus, and it shows all the details here. Here you can also select and deselect the pins. And you can also adjust the font size. The next one is display mode. It includes orientation and show or hide cross references, and dark mode you can select or deselect it, and overlay opacity, and also you can take screenshots. And the next one is language. You can select your desired language. It supports global learning, and the finally is advanced setting. It's for to select the image quality, performance, and custom layouts like reverse scroll, point animation, and display shortcuts. And you can also reset settings, and you can also share it. If you find this helpful, subscribe to Akademixx Global for more medical education content. Thanks for watching.